As an aesthetic nurse practitioner, here are 5 things I would never do to my face. Number 1, I would never get filler in my nose or in my frown lines. Those two are the highest risk areas for filler-related blindness and tissue necrosis. Also, over time, if you get a lot of nose filler, your nose bridge will widen and give you an avatar nose.
So the first thing I'd say about this video is it's really important that every practitioner makes their own assessment of what they feel they can tolerate in their practice in terms of safety. Because if you do something that you're not comfortable with, you're not going to sleep well, and then there's no point really. You can have your own rules on injections and risk. But the reason why I disagree with this from my perspective is that everything has a potential risk. And although you could say that the nose is the number 1 risk, that doesn't mean that it's too risky to treat, because everything has a number 1 risk. You could say sitting in the passenger seat of the car is the most likely place that you'll die, so you'll always sit in the back. Well, that kind of makes sense, except for the fact that, of course, you hardly ever die when you go in a car, so it's okay, most people would say, to sit in the passenger seat. And there are millions of examples like that. The real question is, what's the absolute risk, and can you offset that risk with the benefit to the patient and also the benefit to the clinician? I feel comfortable with the way that I do non-surgical rhinoplasty and even treat frown lines to say that I can probably get through an entire career without having to worry about anyone getting even a necrotic injury, let alone a vascular occlusion that causes blindness, which is really what we're worried about. And that's because I do multiple additional steps and validations all the way through all my procedures that make this less likely. I'm thinking about complications all the time, and that's why I feel comfortable enough to do these procedures when I think the benefit outweighs the risk.